There was a time in medical history when survival depended less on knowledge and more on guesswork. Doctors worked under extreme urgency, where even the strangest ideas were tested on the human body. Blood loss was one of the deadliest problems in early medicine. An injury or childbirth complication could kill within minutes. There were no blood banks, no antibiotics, and no understanding of immune rejection. In desperation, they began experimenting. First, animal blood was tried, but the results were terrifying. Still, they did not stop searching. Then came one of the most shocking ideas in medical history. Milk, ordinary cow's milk, injected directly into human veins as a replacement for blood. The body rejected it violently, causing fever, clotting, organ failure, and sudden death. Many patients died within hours. What was meant to save lives became one of the most disturbing medical experiments ever recorded. Before modern science shaped medicine, doctors worked in a world of observation without real explanation. They could see symptoms clearly, but had no knowledge of the microscopic causes behind disease. Germs were unknown, and the idea of infection spreading through invisible organisms did not exist yet. Blood circulation was also not fully understood in many places, and crucial concepts like blood types and immune reactions were completely unknown. Because of this, the human body was treated as something far simpler than it actually is. Surgery was harsh and painful, often performed without proper anesthesia. Infection after operations was extremely common, and many patients died not from the surgery itself, but from what came after it. In that time, survival was uncertain, and death was a frequent outcome, even for treatable conditions today. This created a world of constant medical desperation. Blood loss was one of the fastest ways a patient could die, and doctors had almost no effective way to replace it. Because they believed blood was the core essence of life, they started imagining that any life-giving fluid might restore a dying patient. Without understanding biological compatibility, they assumed the body might accept substitutes if they carried enough nourishment. This simple but dangerous belief became the foundation for experiments that would later be remembered as some of the most shocking in medical history. The first major step into transfusion experiments involved animals. Physicians attempted to transfer blood from sheep, dogs, goats, and calves into human patients. The idea seemed logical at the time. If blood carried life, then any warm blood might restore a dying body. Early reports were mixed. A few patients showed temporary improvement, which encouraged further experimentation. But soon the true consequences appeared. The human body reacted violently to foreign blood. High fevers, uncontrollable chills, internal clotting, and sudden collapse became common outcomes. Patients who initially seemed to improve often deteriorated rapidly. Doctors were confused because they did not yet understand that blood is biologically specific. Instead of abandoning the idea, some believed the method needed refinement. This mindset, hope without understanding, kept the experiments alive longer than they should have continued. As animal blood experiments began to lose credibility, physicians started searching for a safer alternative. Around this time, milk gained attention as a possible substitute. It was seen as pure, nourishing, and essential for growth in infants. Some doctors began to reason that if milk could sustain life through digestion, perhaps it could also sustain life directly in the bloodstream. This was a critical misunderstanding of human biology. Without knowledge of digestion, immune response, or blood chemistry, they assumed that nutrients were universal in effect, regardless of how they entered the body. The idea spread in certain medical circles. Instead of risky animal blood, perhaps sterile cow's milk could be injected into patients to restore strength. This theory marked one of the most dangerous shifts in early experimental medicine. When milk was injected directly into human veins, the results were immediate and devastating. The circulatory system is not designed to process fats, proteins, and large molecules in this form. The body treated the milk as a foreign invader. Immune reactions triggered intense inflammation. Blood began to clot in abnormal ways, blocking vital pathways. Oxygen delivery to organs was disrupted, causing rapid deterioration. Patients experienced severe pain, fever spikes, breathing difficulty, and sudden weakness. In some cases, the reaction escalated into full-body shock. Organs such as the kidneys and lungs began to fail under the stress. The heart struggled to maintain circulation as blockages spread. Many patients died within hours of the procedure. Others survived slightly longer, only to suffer irreversible internal damage. The experiment revealed a brutal truth. The human body does not accept shortcuts. What nourishes through digestion becomes deadly when forced directly into the bloodstream. As deaths increased, medical professionals could no longer ignore the consequences of these experiments. Reports of fatal reactions began to spread across medical communities, and the practice of injecting milk was gradually abandoned. Around the same time, medical science was undergoing a transformation. Discoveries about blood circulation, the immune system, and eventually blood typing began to explain why earlier attempts had failed so catastrophically. It became clear that blood is not interchangeable, and that compatibility is essential for survival. These revelations marked the end of an era defined by trial-and-error medicine. Safe transfusion practices were eventually developed, turning what was once deadly experimentation into one of the most life-saving procedures in modern healthcare. The failures of the past became the foundation for future success. The story of milk transfusions is a reminder of how fragile the boundary is between innovation and ignorance. These doctors were not villains, they were people trying to save lives with the limited knowledge they had, but without understanding. Even good intentions can lead to tragedy. Modern medicine stands today because of these mistakes, each one teaching a lesson written in loss. If this story showed you how strange and dangerous the early days of medicine were, then remember this. Every safe medical treatment today exists because someone once learned what should never be done again. Subscribe for more true untold stories from history, stories that sound impossible, but actually happened.